First, we have worked with the Department of Transportation to mobilize our highways' electronic messaging signs at entry points across the state to remind those coming from out of state for an extended period of time to quarantine for 14 days. So our citizens may be seeing them as they travel around the state to and from work in the coming weeks. Second, as we mentioned earlier this week, New Hampshire has received 15 Abbott rapid testing devices. And while it is very good news that we've received these testing devices, FEMA has only sent us a limited number of cartridges which are needed to actually perform the tests. Unfortunately, we've been told to expect only about 15% of the cartridges that we've respected from FEMA. So you can imagine my frustration in being given some great tools to fight this and combat this viral epidemic, but not be allowed to use them at even a fraction of their capacity. What we can use, we will, and we'll get those ones deployed very quickly, and we'll keep putting pressure on Washington to provide the supplies that we need and supplies that only they can provide. Third, there has been some concern regarding a state property site in Laconia being contemplated to temporarily house vulnerable homeless individuals who require a safe place to quarantine and have no place to turn. Unfortunately, misinformation was released publicly before any details were ever discussed. Transparency has always been a hallmark of my administration as we progress through this crisis, and that commitment to transparency remains firm. It helps build public trust in this unique and ever-changing process. I want to urge individuals to be ever cautious of the rumor mill and misinformation, because as soon as the state plans for the site in Laconia were ready, local officials were contacted immediately and then quickly understood and appreciated the state's approach. So we'll continue to evaluate up to dozens of housing sites across the state for various populations, and we'll work very closely with our local partners to ensure transparency with their respective communities. Finally, I want to provide an update on our state's unemployment insurance program. Since I signed an executive order on March 17th expanding unemployment benefits, New Hampshire has truly become a leader in getting folks relief fast. In just 3 weeks, Unemployment Security here in New Hampshire has issued over 67,000 total payments with nearly $19 million in benefits paid. Just this week, approximately 30,000 payments were released, totaling $8.5 million. This is all thanks to the incredibly hard work of the folks at Employment Security working around the clock to provide financial relief to those adversely affected by the COVID-19 epidemic. We appreciate our citizens' patience as we continue to make the application system simpler and more robust, but to date our team is doing a great job and continues to provide that one-on-one service to the over 100,000 people seeking help. It's truly a staggering number of individuals, and I can't tell you enough how proud we are of our team. They've stepped up, served a lot of hours, and they're serving our citizens incredibly, incredibly well. I'm now going to turn it over to Health and Human Services Commissioner Lori Shibinette for a public health update.
Good afternoon. Today we are reporting out new numbers as of 9 o'clock this morning. Total persons with COVID-19 in New Hampshire at 788. That is an increase of 41 cases as of 9 o'clock this morning. Persons who have been hospitalized at 118 for about 15%. Total negative tests or total tests done, 8,763. We are reporting out number of deaths today by COVID-19 as a contributing factor as 18, which is 5 new deaths today. Our increased number of deaths is related to 3 residential or nursing home outbreaks within our state whose residents are considered high risk with advanced age or multiple underlying conditions. These long-term care facilities or residential facilities have worked very collaboratively with the public health departments in both Manchester and Nashua to contain the virus and minimize the negative impact on their residents. These 3 outbreaks include Hanover Hill Healthcare Setting, whose outbreak is confined to just 1 floor, but has resulted in 37 positive COVID residents, 13 staff, with 4 confirmed deaths. The second outbreak is at the Huntington at Nashua, an assisted living facility, and the assisted living facility on their campus only resulting in 19 residents with confirmed COVID-19 cases, 11 staff members, and 5 confirmed COVID-related deaths. There have been no new cases at this facility in the last 3 days, but we continue to see staff with positive tests coming out of this facility. The third being Cratchit Mountain Foundation, their residential care facility. 3 residents testing positive for COVID, 11 staff members with 1 confirmed COVID-related death at that facility. In addition to these 3 outbreaks, we have dozens of facilities, I will say more than 10 facilities that have isolated incidences of COVID positive tests either in their residents or in their staff. We're not going to report on all of those isolated incidences, but if those facilities start to experience something similar to an outbreak, we will work with them, as we have done with the 3 facilities that I just named, to do public releases and be very transparent with their communities. We helped the facilities that I named today draft and review letters to their residents very early on in this process, and we encourage anybody that has positive COVID cases to be very transparent with their residents, their families, and their teams. The department, both the Department of Health and Human Services, the Division of Public Health, the Manchester Health Department, and the Nashua Health Department work hand in hand with all of these facilities to make sure that we are providing them with the latest and most up-to-date information and making sure they have everything they need to meet the needs of their clients and their team. Thank you.
Thank you, Commissioner. Before we open it up to questions, I just, we've had a couple days here where the new positive test results are below our high water mark. At one point, I think we had up to 81 in a single day of new positive results. We haven't seen numbers like that in a few days, and that's incredibly encouraging. A couple data points do not necessarily define a trend. We're not quite sure where we are in the surge or in the model. We're constantly reevaluating, and one thing I emphasize all the time is that data trumps models, and constantly looking at the data and reevaluating where we are in this process, this very unknown, ever and very rapidly changing process, to assess our needs from both equipment, supplies, PPE, beds, testing, all the things we've been talking about over the past couple of weeks. So we're encouraged by those numbers, but let's not forget, we had 5 individuals we lost over the past couple days. And unfortunately, we know that we're likely to be in this position for a little while longer. And there very well could be more loss of life. Those are families that you just, they don't want to hear that the results, that the positive results are lower today. They're dealing with a loss of a loved one. Especially in some of these long-term care facilities, you have situations where folks are very limited in their physical contact with those loved ones as well. And so our heart definitely goes out to them and to those families, and our heart has to be with what is coming up. And that's why I said it last week, and I stick to the idea that some of our toughest days are really still ahead of us. We still have well over 100 people that are hospitalized. Unfortunately, we know that some of those hospitalizations may result in more loss of life. This viral epidemic is real, and it's attacking people and families, and it's devastating. It really is. So we hope that some of these numbers continue to decrease. But in the meantime, we have to stay ever vigilant and understand that we are going to be in this process, definitely not just for a few weeks, but likely for a couple more months. And again, we want to get out of it as quick as possible, but our hearts really just go out to those families and again, those who continue to struggle with individuals who have been hospitalized and unfortunately will be hospitalized in the coming days. We're going to continue to attack it with everything we have, and we're going to continue to move with every bit of speed and rapidity that we can, whether it's on action, whether it's on funding. The commitment to the people of this New Hampshire, of our state, is very clear. We are going to move fast. We're going to get people relief and the help that they need, whether it's as their individual families, whether it's through unemployment, healthcare services, testing, PPE, support to their small businesses, whatever it might be. We are going to stand ready to react and be rapid in our deployment as soon as supplies and funding become available. So, with that, we can open up for questions if folks like.
So, what is the threshold for reporting out of the long-term care facilities? Number of cases, deaths. because, as of
Sure.
last week, it was inappropriate.
Yep. So again, if there is an outbreak within the facility, an outbreak isn't necessarily one that would be determined based on the size of the facility, the number of residents at that facility, and the number of folks that are potentially infected. But I don't know if you want to add anything to that. But
Sure. So we really look at the number of people and the ability to contain the outbreak, right? So if you can have a facility that has one staff member, even 2 or 3 staff member that were screened at the front door and caught before they get in and didn't transmit the virus anywhere, you can have 1 or 2 residents. When we look at last week when we said anytime we have a facility that has a positive case, we encourage them to, reach out to their staff member, and we've seen that consistently across the board. We have seen facilities send an email or send a letter to families to say we had a positive COVID, and I think that's really, really important. When it gets to the point where public health has to get involved and we continue to see escalating numbers over several days, that's when we feel like a public notification is really important. So, last week, although there were several cases, we didn't see quite the escalation in some of these outbreaks as we have like over the weekend and into to the last couple of days. The Nashua facility hasn't had any new cases in residents over the last 3 days, but are still seeing staff outbreaks. So their numbers were big enough. We're starting to see the mortality rate in those facilities increase as we go into the 2nd and 3rd week of this illness. So we think it's really important to be transparent with the public.
So how would you characterize what the state is doing at these facilities and other affected facilities at this point? Like what's going on? I mean, to say, Hanover.
Sure. So let me just say first and foremost, everybody has PPE. These facilities and all the facilities, we haven't heard anybody that have positive cases as PPE being a limited factor. It's not a limiting factor. We've opened up testing because of the high risk nature of long-term care facility, congregate living, residential facility. As soon as we identify the facility as having a potential outbreak, we then ramp up testing. Testing has not been a limiting factor in responding to this at all. We have virtual public health reviews with them. We have daily phone calls with either the public health department. For Hanover Hill, that would have been Manchester, and for Huntington, it would have been Nashua. For Crotchet Mountain, it was our public health division, and they all talk to see what else can we do differently. So, it's every single day it's managing active screening of staff, active screening of residents, and we coach them through that, and we make sure that they have all the tools that they need. These facilities aren't necessarily, this is not a new thing. COVID-19 is a new thing, but managing an outbreak in a facility is not a new thing for long-term care facilities. Every year we do influenza, we do norovirus in our long-term care facilities. So they are well versed in infection control practices.
Can you describe if those total numbers coming out of the long-term care facilities in terms of positive cases? Do they include workers there along with residents, or is it just residents?
So then the numbers I gave at Hanover Hill, 37 positive residents, 13 positive staff. So combine those together, and then 11 at Huntington and Nashua, 19 residents and 11 staff.
Commissioner, nationally, these reports on should loved ones take their folks out of nursing homes. Could you speak to the anxiety people might have? We're certainly not seeing the outbreaks here that we've seen in other states. And obviously the nursing facility is in almost every case the most appropriate place for them to be.
Sure. I think everybody's reaction is individual, but what I can tell you is that overall, the general public is anxious. There is a fear level in the general public. So then when you compound that with being in a high-risk population like over 60 with multiple underlying conditions and in a residential facility, I can just imagine how difficult that is for families that really don't have another choice because maybe they can't provide the medical care or the complexity of the care in the individual home. So I validate that is a very a situation that causes a lot of anxiety, both for the families, I'm sure for the residents of the nursing home, for the teams that are taking care of them, knowing that both they could be exposed or they could expose a resident, and for the general public.
Can you, the governor, describe how it unfolded that these machines came to us from Washington or wherever they were, and you didn't come with all the
Do you want-
proper functional equipment?
Sure. So we got word about a week and a half ago, that these machines were likely going to be available, and then it was nice to see within a couple days we heard there was going to be about 15 of them available to New Hampshire right away. A couple days later, they showed up, which was a great relief. We don't always get exactly what we think we're going to get, but when the machine showed up, that was terrific. They came with about 120 test cartridges. Those are the actual number of tests that you can perform. About 20 of which will have to be used to essentially calibrate and test the machines and make sure that folks are trained and we can use them appropriately, and we're going to get accurate results. But that leaves only about 100 actual tests for 15 machines. One of the initial ideas is to take about 50 tests each and deploy 2 of the machines fairly quickly, but that leaves 13 machines that could be doing a lot more testing. We've inquired as to, okay, we want to make purchases for these new cartridges. It has to be done through FEMA right now. Is that right? Yeah, through
CDC.
The CDC, through the CDC, through the federal government, essentially. It's a proprietary reagent that has to be used, so it has to be done there. What we've been notified is of the amount that we've requested, we're only going to get about 15%, and frankly, we don't know when. So it's incredibly frustrating because there was a lot of talk about this device. There was a lot of hype on it nationally, and that was wonderful. And then when they showed up, expectations were set really high, as they should be. But to actually have these 13 of these devices and have no way to use them, I'm banging my head against the wall. I really am. It's really frustrating. And so, we're going to keep pushing on Washington multiple times a day until we get what we need, because that's my job and that's what we're going to do. But you can imagine the frustration. Washington, D.C. Yeah, absolutely. Why would you send out 13 machines and not send it to a state and then not give them any ability to use it? Like none. There's literally nothing you can do with this machine if you don't have the proprietary stuff coming from the CDC and FEMA. So it's incredibly frustrating. Of course, it's their responsibility. Yeah.
Is there a contact person that you've been reaching out to every day, or do you kind of get pushed around with people?
No, we don't get pushed around. I mean, we talk to everybody, right? So Commissioner Shibinette has her contacts within HHS. Perry Plummer has his contacts within FEMA. I have my contacts within the White House. So we keep pushing on it at every level, and we are going to keep pushing, and we're going to get louder and louder and louder about it, because we're not the only ones, right? My guess is that there's quite a few states out there that are not on the top priority list, and I appreciate a lot of the top need has to go to those priority states of New York, New Jersey, Massachusetts. I get it. I understand why the federal government would want them to be first in line. But you don't release the devices and then say, we'll get to you when we can get to you. And even when we do, it's going to be a fraction of what you need. So it's all about setting expectations. You have to be transparent and clear and concise. Even if you're not giving the best of news to the citizens of your state or your country, whatever it is, you got to be clear in a crisis. And it's something that I take great pride in with our team here, that we've been very clear about the situation as we move forward. And that's why I want to be very clear with people here. I'm disappointed in the expectations falling completely flat. And I think the people of the state should be disappointed as well. We're going to keep fighting. We're going to keep pushing hard. We got folks that stay up into the wee hours of the night, whether it's talking to Washington, D.C. till midnight. Usually we're on the phone to overseas trying to get PPE from folks in the early morning hours. It's a 24/7 operation here, but this one was very, very disappointing.
Is that the reason you're hearing that the service in other states?
I think that's an assumption on my part, but probably a correct assumption, if I may, that they're likely going to, as they have done with PPE, as they've done with equipment and supplies, they've been constantly prioritizing other states who do have a much more severe need and crisis than we do. I completely appreciate and understand that. But again, if that were the case, then be transparent to the other states and say, look, we could send you devices, but you're not going to be able to use them because we're still developing our reagent, it's being developed, or whatever it might be. Just be clear and concise, because that allows us, as governors or other folks around the country that are operationalizing the opportunities out of Washington, D.C., that allows us to be very clear and transparent with our population as to why we might not have the test yet. But unfortunately, expectations were set very high, and we're temporarily handcuffed in terms of our ability to use them to their fullest extent. Not even close, frankly.
So what are they saying, though? I mean, they're saying we'll get you when we can.
Mhm.
You say you're assuming it's because they're serving other states. So
Yeah.
what are they telling you when you call?
So they have about 16,000 cartridges available, and the vast majority of those will be immediately deployed into the states of most need. And then they're giving us a rough number, which is a fraction of what we've asked for, but there's no date as to when that might actually happen. Could happen tomorrow, could happen a month from now. We just don't know. Again, that level of uncertainty I find incredibly inappropriate in the time of crisis. We have to be able to communicate with our citizens what their expectations should be, what our expectations should be, so that, again, folks know what the next step is. We can't just be taking this moment by moment. We have to strategize, plan. Where are these going to go? How do we implement these? These devices would be absolutely fantastic for a long-term care facility, potentially, right? To test the employees, to test the workforce, to test those individuals within those facilities, to get better isolation. That's what these devices are designed to do. So it's an incredibly powerful tool that right now we're extremely limited in our ability to utilize. Oh, sorry, go ahead.
Can you just describe right now what your timeline is for deciding whether or not you're going to need to extend the stay-at-home order? When would you be making that decision?
So most of our orders right now go through May 4th. They all line up to about May 4th. My guess, and I'm just guessing right now, maybe about 2 weeks, 10 days beforehand. We're not going to wait till the very end because we want people to be able to plan, whether it's their business, the actions in their daily lives, remote learning. And we're going to start looking at, depending on where we are, right? What do the numbers look like over the next week? We're going to have to take each piece individually. It isn't just, are we going to continue everything? We may, I suppose that's an option. But we might have other options with remote learning, other options with how we handle parks, other options with how we handle essential and non-essential businesses. So we're going to really look at each one individually, look at the data around each one, making sure whatever decision we make is going to put public health at the absolute top priority, as we have the entire time. But again, if we can provide some flexibility, we want to provide flexibility as soon as we possibly can. God bless the people of the state. I've been saying it all along, but you can't repeat it enough. It's the people of the state that deserve all the credit in the world for why we're not in a situation like other states are, because they're the ones that took that discipline on in terms of social distancing, that discipline on in terms of the stay-at-home order, the discipline in saying, look, we have to shut down our business. I mean, those are life-changing events that we've asked people to take on, and they have. And the numbers so far are bearing it out. We're starting to finally see some of the fruits of those initial actions we took a couple weeks ago with less positive results. Now, will that withstand the test of time? We hope so. We really do. We don't know. When we come out of this, we talked a little bit about the challenges we'll have with the decisions as we come out, because you don't want to flex too hard too fast. It sends the wrong message. You don't want to just tell folks, well, we're just all going back to normal, because normal is going to be very different. There's going to be a new normal in a lot of our daily operations of life, unfortunately. So we want the messaging to be appropriate, we want the flexing to be appropriate, but we also want people to understand that these physical distancing and social distancing and the disciplines we've done so well so far, we have to have some stamina and discipline to do it, not just a few days or a few weeks, but maybe in a couple months into the summer to make sure that we're truly out of this. Because otherwise you're going to see another spike. And again, that would be the absolute worst thing if we've had this up and down and we're coming through pretty well, but we loosen up too much too fast, and all of a sudden you see another surge and another spike, and we're back in the exact same place we were. That's absolutely what we don't want to see. So we just need to be careful with the timing and the messaging.
Governor, your Gopher committee?
Yes.
There's been some-
Do you like the name, the Gopher Group?
Yeah.
They get things done. They go get it done.
There's been some pushback from some in the legislature that the fiscal committee has this authority to approve COVID-19 spending. Now, the AG addressed this today at the council meeting.
Yes.
But I wonder if you could spell out why you felt the need to create a new bipartisan advisory board as you have.
Sure.
Rather than go through the normal process.
Sure. So the question really surrounds this new office that I've created. We're calling it GOFER for short. It's the Governor's Office for Emergency Relief and Recovery. And this is the office, similar to the office that Governor Lynch set up, as the legislature advised me to look at that model done in 2009, which is exactly what we did. We'll be an office within the governor's office that essentially draws down, and whether it's federal funds, whether it's relief funds, or maybe even future stimulus funds, and advises on where exactly those investments need to be made, whether it's in the small business community, whether it's in the nonprofit community, all the different needs of this state as it relates to the COVID crisis. It could be in healthcare and public health, hospitals, whatever it might be. So that group is going to have quite a task looking at a variety of different areas of where to present those investments. The state of emergency allows me to draw down the funds and release them almost immediately as soon as they become available. They're not available yet, but as soon as they are, we're going to be able to draw them down. For transparency's sake, because we're always trying to be very transparent, I brought an item to the fiscal committee. I didn't have to, and asked to be put on the agenda for the upcoming fiscal meeting. They didn't want to take it up. They chose not to take that up. So, okay, we're going to draw that money down. We're going to put efforts forward, and we're going to make sure that the people of the state know that when money becomes available, it's going out the door. And we're going to have a plan in place, and we're going to have action. Now, the legislature typically doesn't move with such immediacy. I appreciate that, which is exactly why I created this bipartisan group, 4 Republicans, 4 Democrats, 4 members of the House, 4 members of the Senate, all leadership, all of them. And I've invited them to sit as an advisory group to meet as often as they would like and be very much part of the process. That ensures that transparency. That ensures their ability to be involved with things like accountability, fraud and waste, metrics. You know, what metrics are we going to use to not just invest these dollars, but that we're going to look for some of these folks to come back with results. There's just a variety of areas that are going to have to be addressed, and we want the legislature. We didn't have to create that. Governor Lynch didn't even create an advisory group, but we did. No knock on Governor Lynch. That was a very different situation. His were in 2009 were more stimulus funds. This first phase are more relief funds, and they have to go out with absolute immediacy. The issue of this crisis is very different than what you saw in 2009. It isn't long-term economic default. It's really a short-term external variable that has absolutely crushed our economy and changed people's lives very, very quickly. So we have to respond very, very quickly. The guidance document for these funds will be released hopefully early next week, with the idea that the funds would be released very shortly thereafter. So, you know, our time schedule is right now. And that's and I've designed that time schedule because that's the schedule that the people of the state are expecting, right? I have small businesses potentially going bankrupt every single day. Now, the federal government has opened up a lot of opportunity with the Paycheck Protection Program, and I give them a lot of credit for that. Tens, if not hundreds of millions of dollars in small loans have already gone out to a lot of the small businesses of the state through their banks, and I encourage everyone to, if you have a small business, contact your bank, see what opportunity might be there. That's a great opportunity. But these funds are really there to fill in a lot of the other gaps. We're going to have education funds coming down, community development block grants coming down, LIHEAP, which is essentially fuel assistance coming down, in a lot of different areas, right? So we have to be able to kind of digest that and move very, very quickly, which is exactly what we're going to do. It's exactly why the state of emergency powers were designed the way they were following the 9/11 crisis. They were designed to allow the governor to move and take action and release funds with absolute immediacy. The legislature designed it that way, and so we're going to use it to its fullest extent. Oh, there's no question about the interpretation. It's absolutely right. That's exactly how the law was designed. That's what a state of emergency for the governor allows me to do. That's why I've been able to take such aggressive action to date. And with that aggressive action, the result is we're in a much better shape than a lot of other states otherwise would have been, right? We took very aggressive action in terms of asking for the stay-at-home order, you know, pushing the essential versus non-essential businesses. And because I was able to do that quickly, we're in a very, very good position. And when the relief opportunity starts to come, we're going to take the same action with the same sense of immediacy.
Can you explain why you don't think the fiscal committee can move with a sense of immediacy?
Why? I missed the question.
Why you don't think the fiscal committee can move with that same sense of immediacy?
The fiscal committee meets once a month. It's a legislative body. It works it's very different. The fiscal committee has a great purpose, of course, but it's designed to take public input, to bring in the commissioners at every level, to question every bit of the process, which they absolutely should, to draw down those federal funds. So it's not that the fiscal committee can't do a good job. They have a very important role, but not necessarily in the realm of drawing down funds and being able to release them immediately. But again, a lot of the folks that we brought onto the advisory board are from the fiscal committee, right? We've allowed those members of the fiscal committee to essentially move at the rapid pace that the governor's office currently does, right? So we've tried to be innovative to, again, kind of join them at the hip a little bit so we can move forward quickly. But the fiscal committee itself is a very different body with a very different purpose. And again, I brought the item to them for transparency. I said, well, why don't you at least draw down the funds and be part of that process? They wouldn't put it on their agenda. I don't know why. You'll have to ask them. I don't care about those kind of games. I don't know what's going on over there. My job is my priority is the people of the state. They need to know that the money is going to come, the immediacy is going to be there, relief is on its way. Yes, sir.
There's been a lot of stories across the country about the payroll protection plan not working very well for small business owners, a lot of bureaucracy that's holding up lending. What's happening in the state? What are you even hearing from small business?
So I've been talking to both small businesses and banks. It's a federal, so the question really revolves around the success or the frustrations through the Paycheck Protection Program. It's administered through the small banks of New Hampshire, or the banks of New Hampshire, I should say. Virtually all banks are partaking in that process. I've talked to some small businesses, I've talked to some bankers that said, look, it's a federal process, so it has its clunkiness to it, but loans are being made. I mean, their applications are being accepted, loans are being made to the tune of, I think we have well over $100 million. I just did a rough scan of maybe a half a dozen banks in the last 24 hours, and it's moving forward. So I think look, any time that your business is about to go bankrupt, you've been absolutely devastated for reasons that are completely out of your control. My sense is you had a lot of businesses, and rightly so, just lining up at the door of the bank on Friday morning saying, look, let's go. How do I get my loan? How do I get my money and save my employees and my business? My sense is that it's going to come quickly. I don't know, maybe it's never quick enough for someone in that position. You'd have to, I guess, talk to some of those businesses and the banks to see what kind of response they're getting. But so far, it seems to be working fairly well. We're going to keep pushing hard. It's not going to be a perfect process for everyone, to be sure. And we'll keep pushing on the federal government to streamline their process. It's not really our process. It's really a direct ask to the federal government through your local bank. And again, because our banks are so good here in New Hampshire, they're stable, they have great connection with the community, they have great connection with the customer. So I think a lot of times the banks will have to spend that one-on-one time with their customers, walk them through what the process is, and again, make sure their expectations for the program are where they are. But you're talking about payment and benefits for 8 weeks for your employees in a loan, a short-term loan that ultimately can be completely forgiven by the federal government as long as you hire most of those employees back. That's an incredible opportunity. That's a great sign that the federal government is wanting to step up and make sure that the disruption to business and lives is minimized as much as possible. They still have their process, but again, hopefully because it's being administered directly through our local banks and not the SBA directly itself, that'll help streamline it a little bit. Yes, sir.
Did you, while different than what happened at the Great Recession, did you speak to Governor Lynch at all about this process and or anybody else on that?
Yeah, we've talked to the whole team. I mean, we talked to Bud Fitch, Chris Clement, a few of the folks. You know, back in 2009, theirs was more of an auditing process. They had a budget that they could move their money through. We are in the middle of a budget process here, and that would take, far too long. It's going to get hung up in the legislature for weeks and weeks and weeks. So we're in the middle of a budget process, so we don't have that advantage going for us because of the immediacy here. And most of what they did was on an auditing standpoint, making sure the dollars went out, met the metrics of the federal government. There was a minimal amount of fraud, waste, and abuse. They had a great transparency infrastructure we talked to them about, where folks could go online and click on a map, see where the dollars are going. That's the type of transparency and infrastructure we want to build as well.
Can I follow up about the weekend hike challenge that we had?
The Home Hike Challenge.
So you said
There's a hashtag there somewhere.
Press conference before that you couldn't block out-of-staters coming into the state.
Yes.
And you heard from a couple of people ask us specifically, I think it was Mount Monadnock, 90% of the parking lot, one of the state officials had said was full of out-of-state money. If this weekend is similar to that weekend, and out-of-staters are not quarantined, and they're still coming, will you, have you thought about doing something like limiting access to parking lots like they do in Kank with you have to have not the preservation license plate, but the parks license.
Sure.
Right. Have you thought about doing that in case it's as bad
Sure.
as it was last time?
So the question really revolves around what actions are we willing to take with the parks if we keep seeing kind of an onslaught and a run into the park system. So to take a step back, I think Commissioner Sarah Stewart from the Department of Natural and Cultural Resources, as well as Phil Bryce, the head of parks here, did a great job last week, really staffing up and making sure we had folks on the ground to help manage the crowds better and some of those high peak areas. The reports we got back were actually very favorable. It looked like they had done a very good job. I think everyone was taking their social and physical distancing very responsible. The Home Hike Challenge, there's a hashtag in there somewhere, was also incredibly successful. Everyone was posting their home hikes online. I got to give a shout out to WHEB and Greg in the Morning Buzz. It was his idea. I'm going to give you credit. his head just got bigger. But that's it. People stepping up and having good ideas and kind of taking that to the next level and really operationalizing that good idea. I came up with Home Hike Challenge. I'll take the credit for that one, I guess. But operationalizing it and letting people really embrace it, right? And the idea wasn't just some fun social media thing. It really had a public health benefit of keeping people more physically separated, of elevating that messaging of, for those of us in New Hampshire who traditionally might go to Mount Major or Monadnock and we love it, those are amazing places. Maybe we'll wait for those hikes for a little later in the summer, right? Let's explore our own communities. So I cannot keep folks just from Massachusetts or another state out of our parks. That is unconstitutional, and it is not allowed. Could we limit the parking spots? Yes, we could possibly take that approach if we have to down the road. My sense is as it gets warmer, those types of actions very well may become necessary because people are going to just be more inclined to go out and go for that hike and get that fresh air and that exercise, which we do encourage. Again, still healthier at home. We want folks to really abide by the stay-at-home order. But if you have to and want to go hiking for that fresh air and that exercise, we want you to do it in a safe way. So as it gets warmer, as we go down the road, there are additional steps that we could possibly take. We could, if certain parks are getting more overrun than others, we could shut down certain parks but not the entire system. We could limit the number of parking spots. But what we unfortunately cannot do is say, well, you don't have the right license plate and you do, right? So that's becomes a bit of a challenge with the Constitution. And look, we want all these folks from Massachusetts to come back at some point. We're a tourism state. We love to have their business, just not now. Right? You're healthier at home and you're healthier in your home back in Massachusetts, Rhode Island, Connecticut. We know you love New Hampshire. We love it too. But we're asking folks to really stay within their homes at least over the next couple weeks, couple months, until things get back to a more normal atmosphere where we can have a little more of the closeness without the risk of the viral spread.
Can you talk a little bit about the action you took on hydrochloroquine and chloroquine and what informed your thinking?
What actions are you referring to? I just want to be clear.
Did you order limits on certain prescribers?
Yeah.
for prophylaxis?
Yep. So I'm going to defer to the commissioner. That was not me per se, but that was out of the commissioner. Yep.
What we did is we were getting reports that there was a limited number of a limited access to those drugs, that we were seeing in our pharmacies more and more prescriptions, people getting additional refills for those medications that they were legitimately on. Because those medications are used to treat COVID-19, we want to make sure that people aren't stockpiling those medications and they're available for the most critical time, which is around the surge time. So basically what the order did is just limit the amount of medications that can be dispensed at any one time, not taking away from anybody that legitimately needs those, not allow, the order doesn't allow for the pre-symptomatic treatment of COVID-19. There are some people that think if you take these medications before coming in contact with COVID-19 that you will reduce the possibility of becoming symptomatic or actually getting the virus. So we didn't allow for dispensing for that reason. But it was really to just make sure that we had enough medications on the shelves for the treatment, if that's what the physicians choose for individual patients, and also making sure that the patients that take these medications for legitimate disorders and have been for years, that they have access to the medications they need to stay healthy.
So, Governor, this is obviously somewhat prompted by the president's tightening hope that is using these drugs to give service to people.
Yeah, using the and again, I'm gonna pronounce it wrong. I believe it's hydroxychloroquine. Did I say that right? Hydroxychloroquine has clearly been beneficial to some folks, and as the commissioner said, it's about making sure that those in the most need are going to have access to it more than anything. Now, I'll tell you, we are exploring national opportunities to bring more of that and other potential pharmaceuticals in to address this crisis. So we're not just kind of accepting what we have. We're really scouring again what can we do to increase access, but again, making sure that those that are in most need are have access to it, and you don't have the hoarding and things like that. We just need to make sure that there's proper disbursement of it over the long haul. And the long haul isn't necessarily 2 days. It could be months and months ahead.
I don't want to belabor the point on the fiscal committee too much, but you're bringing some items to them and not others related to COVID-19. So why is that? And from a constitutional perspective, the potential that we face pandemics in the future, the framers of the New Hampshire Constitution clearly intended for the legislature to be endowed with perhaps a little bit more power than the governor, arguably. Do you worry that this is setting a precedent that will give future governors even more leeway to operate under the guise of an emergency in situations that aren't a pandemic?
Sure.
Two-part question.
Sure. So the first part, those are, I believe, similar to what we saw at the Executive Council today. We want to be transparent, so we're bringing a lot of items to the council, the council or to fiscal. We can do it, informationally, right? Sometimes it might be after the fact, but we want there to be transparency in those items. In terms of the Constitution issue, the constitutional issue here is unquestionable. It is absolutely not a question in terms of our ability and need to do this. And it's exactly why the legislature phrased and framed the piece of legislation that they created following the 9/11 crisis the way they did, because they knew the governor in certain time periods needed to act with absolute urgency. You have a crisis that is moving, not just day to day, hour to hour. Right? And we've seen it. We've seen us have to move and be mobile on this hour to hour. That is nothing that the fiscal committee, asking them to meet in an open and public setting, it's just not possible. So obviously, including them as part of every step of the approval process is just not feasible and not going to happen. The second that gets kind of jammed up and that log jam happens and we get slowed down, we then have to answer to the people of the state as to why these funds are available and not being released. That is the most critical issue, and that is my top priority. And I tell you, as a governor, I don't make many promises, but that itself is a promise I make to the people of New Hampshire. When these funds become available, we're going to move on them as quick as we possibly can. And we're going to have a legislative advisory group, which we didn't have to do, we wanted to do for the transparency's sake, right there alongside us within that office. So again, I think we've gone over and above in terms of including them. I tried to bring the fiscal item, the item to fiscal. They didn't put it on their agenda. I was told 2 days ago they're not going to put it on their agenda. Okay, so they don't want to be part of the process. That's their choice, right? We're moving forward, and I'm not going to let bureaucracy get in the way of actually getting results and relief to the people of the state. I think we have some folks on the phone, so, okay.
Maybe the commissioner can answer this too. There were indications that the state was going to release more information on the demographics of people affected by COVID-19. What's the status?
I'll jump on that. So Dr. Chan and I are kind of looking at the possibility of doing a little bit of a presentation on modeling demographics, things of that nature. To be honest, I put it off a little bit because the model just in the past 48 hours has changed so much in terms of where we may go, because the numbers are looking better, not just locally but nationally. And we're trying to really dive in and use that data to rebuild the model, not just on a number of positive cases, but on hospitalizations, on mortality rate, all of those things. So we hope to do that very, very soon. But again, we want to be as accurate as we can, knowing that this is one of those crises where kind of what you model today might be completely different by dinner time.
Well, but modeling doesn't necessarily require stuff that's already happened. You
Sure.
put that out.
Oh, you're looking for demographic information on the individuals who are positive or okay.
Yep, we
Yeah.
can do that.
Yep, we can absolutely do that. Sure. Yeah. So let's take some on the phone, and then we can come back to folks in the room if they like.
Our first question comes from Holly Raymer with Associated Press. Holly, go ahead with your question.
Hi, thank you. Governor Sununu, I think it was Monday you talked about how the state has obtained 300,000 pieces of personal protective equipment. Can you clarify what sort of percentage of that was coming from the federal government versus private suppliers? And also talk about what
Commercial orders.
the full amount you requested from the federal government, what percentage has come back?
Sure. So I think the question on the phone revolves around of the over 300,000 pieces of PPE that the state has currently received. What percentage is driven by the federal government versus commercially? Is that the question in its essence? Oh, well, I'll ask the commissioner.
And
Okay.
also, how much of what we've requested from the federal government have they delivered?
So the 300,000 plus pieces of PPE, that is a combination of PPE that we purchased in small quantities commercially, and also what we received through the Strategic National Stockpile. So a variety of different resources, the majority of it through the SNS though. The percentage that we received of our SNS order, I don't have that amount. We definitely did not receive 100% of what we requested.
Our next
Thank you.
question comes from David Brooks of the Concord
Yes, thank you. I have a question probably for the commissioner. This might be something you're going to mention later. In one of your reports, you talked about 4 of the people who tested positive were under the age of 18. And I was just curious as to how much of that you've seen, how many people under 18, how many youths have actually been coming to the patient. And the other question I had is, so far about 91-92% of the tests have been negative. And I'm curious, is that a percentage you expected that other states similar to us are seeing? Thanks.
So I don't know the exact number of children that we currently have positive in the state. It's not uncommon to see some children, especially adolescents, test positive for COVID-19, but I don't have the exact number. As for the percentage of negative tests, I think by and large, most states have seen large numbers of negative tests. We are on the tail end of influenza season. We're at the beginning of allergy season. And because of the heightened awareness around COVID-19 and the potential risks around it, I think, our messaging has always been, if you have mild symptoms, stay at home. If you have mild symptoms and have underlying health conditions, to see your provider, and the provider makes the decision on to test. So I think that out of an abundance of caution, we are testing especially people with underlying conditions, people on a more regular basis. So it's not unusual to see that amount of negative tests. We're also, we've got first responders, healthcare providers that we need to make sure that are, even when they're mildly symptomatic, that they are not positive for COVID-19, because we need them on the front lines of this healthcare crisis. So we need them to go to work. And so for some of those people, even if they have mild symptoms, we are testing them to make sure that they're negative. So not at all surprised. I don't have the exact statistics from other states.
Our next question comes from Mia Summerson with the Keene Sentinel. Mia, go ahead with your question.
Hi, thank you. So we became aware of a COVID-19 death in Chester County that was confirmed on a Sunday, and yet the state numbers didn't reflect that until yesterday, I believe. Can someone explain the lag time between when these results are coming in and when they are reflected in state data?
So the death is reflected in state data when we have confirmation that it's a COVID-related death. So oftentimes we'll hear that a hospital or an individual provider or a healthcare facility may report a COVID-related death, but we have not gotten confirmation from either the primary care physician or the treating physician, or we haven't we're still waiting for a COVID test to come back. So typically public health needs some type of confirmation either through a testing process, seeing a copy of the death certificate, or confirmation from a physician that it is a COVID-related death. That could result in a day or two, maybe even 3 days of lag time. We have currently at least 2 deaths that would be considered under investigation, which means we are waiting to hear either from the treating provider or from a lab, or see the death certificate to confirm that it's being COVID-19 related death. A lot of our deaths right now are with people that have underlying health conditions. So it's important that we differentiate.
Our next question comes from Paula Tracy with In-Depth. Paula, go ahead with your question.
Yes, good afternoon. I have a question about hospital capacity and equipment in the state right now. I was interested in trying to understand what you see as the bed capacity is currently that we have, and also ventilators. I haven't learned a lot about ventilators in New Hampshire, the number used, the number needed, and the number of COVID-19 patients that are now using those devices.
Sure. So the question really it revolves around bed capacity and equipment capacity, specifically within hospitals. So first, let me say the bed capacity within the state is somewhere, I believe we presented it, somewhere well over 3,000 beds that are existing in hospitals or facilities that can be used for the COVID-19 crisis. And then when you add the surge and flex centers that we've created, about 14 of them across the state, you're adding about another 1,500 beds on top of that. So at the end of the day, you're at or above around 5,000 5,000 beds across the state to be able that could come into use if we were to need them for the COVID emergency. Right now, you have just over 100 people in the state that are currently hospitalized for testing positive for COVID and needing a hospitalization. The number of ventilators, one thing we try to stress, I think and again, please correct me if I'm wrong, but we try to stress it's not just ventilators, but it's ventilator-type devices that can even be turned into ventilators or respiratory assistance devices. We have quite a few of those all across the state. Not probably just under 1,000, but right now, we feel very comfortable, I should say, given our current numbers and where we think this surge could go, that we will have capacity to serve those individuals needing respiratory assistance. The percentage of folks that are currently in a hospital and currently on a ventilator, I don't know if we have that number. I'm going to look at the commissioner a little bit.
14.
Please.
About 15% of our COVID-19 cases are hospitalized. Smaller percentage of that, usually about 5%, require critical care, ventilator-type care in hospitals. So we haven't differentiated those out in our total number of hospitalizations.
Our next question comes from Harrison Thorpe with the Rochester Voice. Harrison, go ahead with your question.
Yeah, given that early on young people were falsely given the impression they had little to fear from COVID-19, why can't now the people of New Hampshire be given the age metrics of those in the state with the illness like they do in Maine and Massachusetts? Like in Maine, 20% are in their 60s, 20% of the confirmed cases are in their 50s, 16% in their 40s, and 10% in their 30s. So wouldn't it be good to drive home the fact that these younger people are at serious risk?
Yes, so we are going to release a demographic report, if not the end of this week, early next week, that'll have exactly that information in it. Sometimes when you have small numbers of cases, when you start to report out demographics, it's not good information until you have a certain number of cases that show a pattern or a trend. And we feel like probably for the last week or so that our numbers are at the level now that putting out publicly those demographic informations is of value and it's important information to share. So we do expect to release that demographic report by early next week.
Our next question comes from Nora Doyle-Burr with the Valley News. Nora, go ahead with your question.
Yes, hi. I have some questions. So about the rapid tests, I was wondering, how you had hoped to use them. I think you mentioned you'd like to be using them with the long-term care facilities. And so what does it mean for the state's response to COVID-19 that you don't have access to these supplies that you need?
These 15 devices, one of the great benefits of them is that they're so mobile that we could actually pick them up and move them from place to place as an emergency or an outbreak might occur, which is, I think, why the commissioner and the folks at Public Health, the original design and plan was to be able to bring them primarily into long-term care facilities at first, or bring them up into like the North Country or COAS, where we want to make sure that everyone has access, equal access to testing, and the availability is going to be there for them. So what it really means is that we can't make those commitments right now to that plan. The flexibility is really key. That's why I think the fact we were going to get 15 of them was expectations were very, very high, because that allows you to be nimble, to be quick, to get the data and to move rapidly as you have to do in every aspect of this crisis. So unfortunately, we're not there. Look, we could get a response from Washington in the next couple of days or next week that the reagents are being moved faster than anticipated, and we are going to get more than we were originally told, and that would be wonderful news. But we're not going to make that promise or commitment until we actually see it, not just out of Washington, but I got to see it. I got to see it on the runway. I got to see it actually get out of a truck or a plane here and land in the state of New Hampshire before we're going to make any commitment in terms of exactly how we're going to use these. Because again, we don't want to make false promises and exceed hopes that can't be met.
The next question comes from Abby Trombley with the Monadnock Radio Group. Abby, go ahead with your question.
Hi, Governor. The town manager of Brattleboro, Vermont, said that Vermont state officials are poised at all of the roadway entry points into Vermont, and they aren't restricting any interstate travel, but they are monitoring it. Has New Hampshire done anything of the sort, and should people who live in New Hampshire and work in a neighboring state or vice versa have any concerns?
So the question is, if I may, are they still on? Are you saying, are they? Is what I'm hearing you say that they're restricting travel into Vermont from out-of-staters? I don't believe that's true. They're monitoring travel from out-of-staters. Look, I can't speak for other states and the hows and whys of doing that. We're really not at that point. I don't feel the need to put valuable personnel on the roadway to monitor who's coming in and who's not. We know a lot of folks are coming in from Massachusetts and Rhode Island, Connecticut, even New York. I don't need to have state police on the roads to confirm that. We know it's happening. We haven't heard of any states actually restricting travel. Again, I can't speak for other states' constitutions. It would be unconstitutional here, and I think it's unconstitutional to the federal constitution, frankly. So we heard the stories of what was going on in Rhode Island, folks going home to home where there might be an out-of-state license plate giving folks a piece of paper telling them that they absolutely have to quarantine for 14 days. Again, we're not here at that. We're not at that point here in this state, and we think our messaging truly has been elevated. It's out not just in New Hampshire, but all across New England, and frankly, across most of the country, that if you do travel from out of state, especially in a high-risk area, you are expected to quarantine for 14 days. That's if you're going to have a long-term stay here. I made the very tough decision of closing down hotels and Airbnbs and things of that nature for those visiting travelers to hopefully limit the ability for folks from out of state just to come up for a few days here and there. If folks have a second home here, they have a second home here. They have every right to come in and use that home. But again, they are expected to self-quarantine and isolate for 14 days. We're good? Okay, so we're all set with the questions on the phone. Anything else for folks here? Okay. Well, look, my guess is we're probably going to have another press conference before the weekend, but it is a holiday week, right? Whether you're celebrating Passover or Easter. And, something we try to remind ourselves all the time is gratitude and being grateful for the blessings that we have, especially during tough times. That's when you have to dig deep and really appreciate some of the gifts that we have, especially here in the state of New Hampshire. This team has done incredibly well, and the people of New Hampshire have done incredibly well maintaining their discipline and suppressing that viral spread. Everyone deserves some credit there, but we are in this for the long haul. A couple good data points don't define a trend. We're going to have, unfortunately, we saw it today with 5 new cases, 5 new releases of information that resulted in a fatality. And unfortunately, we know that's going to come again. So I think our thoughts and our prayers need to be with those families. We need to think about that, count the blessings that we have today, but think about the impact that this is really having in a variety of different ways to all our different citizens across the state. We are together in this. We're going to get through this. We're going to get help as fast as it is possibly available. And that's the commitment we have made to this state all along. And that's the commitment we're going to keep all the way to the end. Thank you guys very much.